lot of the continued mixed messaging about different health protocols. We've been asking folks to continue wearing masks. They've been doing that by and large. People are getting vaccinated. The vaccines are starting to come to us a little bit faster. With the VA included, we have over 600,000 people that have already received at least one dose of the vaccine, and a full 450,000, I think. Actually, no, I'm sorry, about 350,000 that have been fully vaccinated. So it's starting to really get out there. The herd immunity will come to us by the summer if this pace continues on vaccination.
And I got to tell you what, you guys have made it really easy, because my experience that I was pretty nervous when I went there for myself, but it was so wait very long. I was really efficient. I like the fact that there's no big computer program you got to go through and everything. They hand you your card. You make sure you don't lose your card, otherwise you're in trouble. But yeah.
Yeah, and keep in mind, everybody in the state of age over 16 is now eligible to receive the vaccine. And so you're right. If you don't have the internet, you can get on to the phone to make an appointment. You can also go to your neighborhood clinic if they have vaccines available. The public health labs are open to be reached either through WellMed, UHS, or Metro Health, and you can call 311, hit option 8, and you can sign up for an appointment. I did that when I became eligible. I waited on hold for about 20 minutes, and I was able to get an appointment. So I can't wait. A week from today, I'm finally getting my vaccine too.
Oh, awesome. Yes, I got mine. My wife had hers. And yesterday, like you were saying, my son, Jeremy, he got his first shot yesterday. So, and, he's just 24. So yeah, I think things, plus, the weather is cooperating a little bit. I think with it getting warmer, that's going to make it a little tougher for the virus to spread much more than it has.
Yeah, and if I can add one other thing, Doug, so we are starting to now receive a lot more doses, getting some help from the federal government. That will ebb and flow a little bit. But we're starting to approach, where we might start to see some folks who are hesitant and don't want to get the vaccine. I can't tell you in stronger, more uncertain terms, please go get a vaccine. This is how we will finally get life back started again and get this pandemic behind us. The vaccine is safe. It has been through very rigorous trials. In fact, the American vaccine approval process is the most rigorous in the world. Some of the challenges that you may see in other countries do not happen here because they do not quickly approve vaccines in our country. And the ones that have been out have been now injected into over 100 million Americans. And all that has been reported thus far is very minor side effects, bruising on the site, things like that. But we've had great success with the vaccine. We want that to continue. So please talk to your doctor about the vaccination process. It is quick, it's easy, and again, it will save lives.
Now, so how long do you think the vaccines will last? I mean, how long do you think they're good for?
Well, that's getting into medical science that I'm not qualified to answer, but what we've been hearing from the medical professionals, other than, that is still being studied, is that it's at least 6 months of immunity. And you can imagine if we can put this virus behind us in a 6-month period of time and have herd immunity, we can really get to the end of this pandemic. Because, really, if we were able to control this virus for a brief period of time and make sure that it is eradicated, we can finally start to open things back up. The state has been open for quite a while, but there's still a lot of consumer uncertainty. If we can get to herd immunity, you will start to see events and activities come back more as robustly as they were back before the coronavirus was even part of our vocabulary.
So what do you think about Fiesta this year?
We're going to have it. It will be slightly modified, and we're going to pay attention to what the health conditions are as we approach. As you know, it's been delayed.
Right.
It's going to happen in late June. And so, I met with the commission this past week, and they are continuing to watch the conditions to determine, what kind of health protocols will need to be put in place, what kind of occupancy limits need to be placed on events. You can expect to likely be wearing a mask at that time during the Fiesta activities. But I'll tell you, if the mask wearing is the only thing we have to really deal with, it's going to be a lot of fun.
Absolutely.
We've all been used up for a year, and it will be well worth some additional caution. And then you can bet that Fiesta 22 is going to be the biggest and best ever.
Awesome. I go around. I get around quite a bit in the city And I got to tell you what, I mean, I don't want to put a percentage on it, but like everybody that I see, whether they had their shots or not, are still wearing masks, you know? And so I,
Right. Yeah, and that's the thing is that despite what the governor may say about mandates and masks, we have been putting the public health guidance out there front and center from the very start. And people are using common sense. They care about each other. They want to keep themselves and their family members and neighbors healthy. And so they're doing their part, which in this case is a very minor inconvenience of wearing a mask when they go out and are around crowds. That's all that's really, at this point, that's our bread and butter in terms of
right.
controlling this virus, until we get people fully vaccinated across this community.
Well, masks now have become a cottage industry, and they are much better than they were when we first started. I mean, whatever your condition, they've got a mask that will help you, that will help you get by. So I'm glad about that. So hey, thank you for that update. So Ron, next I want to talk about because as we talked about at the very beginning of this thing, um, you know, when things like this happen, we don't want to be in the same place we were at the beginning. I think that goes for us as a city and us as individuals. And the thing we had the overwhelming election back in November, and we had the Proposition B that was on that ballot, and it was overwhelmingly passed, and that's what created SA Ready to Work. And so, as I talk to people around, not many people know what that is. So I wanted to see if we could spend the rest of our time talking about that.
Sure. And you're right. Coming out of this pandemic, our focus needs to be getting people back to work safely and also breaking cycles of generational poverty. So getting people back to work in jobs that pay wages that can sustain their families. And in some cases, in many cases in San Antonio, that requires acquiring a skill, a trade for an industry that frankly has been waiting for employees. We have 10,000 healthcare positions in this community that are unfilled, 7,000 jobs in technology, 6,000 jobs in construction. And the reason why they can't hire San Antonians is because they lack the skilled labor. So we're talking about getting folks who are previously unemployed or underemployed, providing them the training for those skills and getting them into those jobs that are waiting. And it's a huge effort, but voters, again, as you said, overwhelmingly approved SA Ready to Work, which is on the ballot in November, 77% voter approval. And where we are today is that we're standing up the program, which is set to begin in September. But the first phase of this is actually already underway, and it's funded by the CARES Act, the federal relief program that was initiated by the city. And currently, I have to tell you, the Train for Jobs program, which is phase one of the SA Ready to Work program, is already showing remarkable results. We have already over 4,000 people, in fact, 4,500 residents have completed the intake process in a little less than about 4 months. Over 2,300 of them are already enrolled in training programs right now. We've actually already had a couple hundred folks for shorter term training certification courses that are part of this program that have already completed their training and are getting placed in a job. In fact, over 100 people have already been on the job after completing their program for the last 3 months. So this has been working very quickly, and it's and again, it shows there's a huge demand for this kind of skills training program in our city.
Well, this, I think it's number one, the group that put it all together and everything, and with your leadership, I mean, they did a fantastic job. I've been to the website, I've checked out everything about it. We just want to just make sure that everybody understands, the important opportunity that lays in front of them, for themselves and their family. So, and that's good. So,
well, I tell you, Doug, this is the largest workforce development program in the entire country. In fact, there's an MIT professor who's interviewed recently and said it's the most ambitious workforce development training in the country. And I have to tell you also that if you look under the hood at these 4,500 folks that are already part of the intake process and the 2,300 that are already enrolled, what's astounding is that we are reaching the very hardest to reach folks who need these opportunities. As you know, the pandemic has had a disproportionate impact on women and on communities of color. And in both of those categories, the bulk of our intake process is reaching women and communities of color. For instance,
Awesome.
72% of the enrollments in this program are women.
Wow.
And 63% are Hispanic, 17% African American. In fact, the highest number of enrollments in terms of city council district, 17% of enrollments are coming from District 2. So we are reaching into communities that have not had their fair share of opportunity, and we're getting those opportunities to those folks.
Wow. That is really something. That is fantastic news, and thank you for explaining that. And I even, as I was telling you, we have Restore Education coming on right after you leave, and they are actually going to be. Finally, we got approval from Ella Austin and from the EDC, so we'll be able to make available space for them if they choose to, choose to make themselves available there. And it looks like they may do that. So.
Yeah, it's fantastic, and I'll also mention that there was some initial stories written about the program and some initial proposals in which as we're setting up this program, one of the proposals was to hire roughly 60 city employees to conduct intake and oversight and everything, and there was concern that this would create another city bureaucracy. I'm happy to tell you that we asked them to go back to the drawing board. They did. They came back with a better proposal. The intake will be done by groups like Restore Education and others who choose to respond to the RFP, who already have expertise in this area. And really, the city staff, operation for this program is really oversight to make sure that the taxpayers are getting what they were promised when they voted for. Hired is more like 10 people as opposed to 60.
Awesome. Well, it is such so. Now, how does Alamo colleges, how do they fit into this?
Yeah, well, I'm glad you asked. So the Train for Jobs program that's currently underway, we obviously, just like this other, the phase 2 essay ready to work, leans on curriculum providers to provide that training. And one of those curriculum providers is the Alamo Community College District, and they obviously provide certification programs in different career fields, and those career fields are aligned with the real world economy, what jobs are out there in San Antonio. We expect that will continue. Obviously, if Alamo colleges were to become a curriculum provider, we would be working with them. That all depends on the RFP process, but I can imagine that they're going to be somehow involved in this.
Oh, I'm sure.
I'd also say that the Alamo colleges, which is, as we know, the best community college district in the nation.
In the country, absolutely.
Yeah. They are also conducting the Alamo Promise program, which now provides for tuition-free college education for every single high school graduate in San Antonio. The other thing I'd mention, since you have Restore Education coming on, Doug, is that in addition to tuition assistance, a lot of times tuition is one part of a challenge created by education and completing your education. Tuition is a challenge. So that is no longer a challenge with this program. The other issue is real life.
Right.
Child care challenge or
transportation
issues or financial literacy. So the Alamo Promise program, along with essay ready to work and even the Train for Jobs program, provides wraparound services to help each student, each enrollee with those obstacles and assistance to make sure that those obstacles don't become barriers to completing their education. So
that's awesome.
This is a well-rounded program, and we're leaning on those providers to provide those resources to each and every participant to make sure that they complete this program and end up in a good-paying job.
That is so. That makes me so very happy. I really appreciate that update. That's the news I was hoping to hear, because so oftentimes you've already stayed out on a beating dead horse, but people get left out, and I'm glad that we're having the coverage that we're having in District 2. And I'm glad for the number of women that are in the program. There is a lady that was at one of the carryout restaurants my wife and I went to, and I just happened to have some of that material in my car, and I shared that with her, and she's one of the people. She just enrolled like a couple weeks ago, so I'm really happy about that.
I ran into someone who had just been laid off from their job because of the pandemic and now had enrolled in a bookkeeping course in this program and was already employed by UHS doing vaccine registry. So
Oh, wow.
it's already happening. It's helping people. And you know, I would also ask one other thing for folks who are listening, Doug, call 311 if you want information about it, or you can enroll by calling 210-224-HELP to enroll in this training program. And I also have to mention and underscore, a minimum education is not required. If you are in the workforce and been laid off, or you're underemployed and in the workforce and did not get your high school diploma, that's not an obstacle. This program will get your GED along the way to training for a high-paying career. So if you have no GED, we still want you to enroll in this program to get into a career path that can sustain you and give you economic mobility for you and your family.
Wow. Well, you know, Ron, you know, I never thought we'd be where we are today when this started a year ago. But you know, thanks to you and Judge Wolf and your leadership, we're almost over this. We're coming out on the other end, and with these programs, Alamo Promise, SA Ready to Work, it looks like we're going to be better off now than we were when we started. So, thank you so very much.
Stronger and more resilient than when we started. And last thing, Doug, I just have to plug. Don't forget, early voting in municipal elections starts a week from Monday, April 19th. Make sure you go vote, everybody.
I was waiting for you to do that. Thanks so much, Ron. I really, really appreciate you. And on behalf of all of the listeners on KROV, thanks for all your hard work.
It's my pleasure. God bless you. Take care.
You too.
Good to talk to you.
KROV FM, the heart and soul of San Antonio. That was San Antonio Mayor Ron Nirenberg, and gave us an update on the COVID, talked about the exciting education and workforce development programs that we have in our city that, as you heard from him, are the most ambitious in the country at this time. So you know, as always, San Antonio, we like to consider ourselves a caring city that doesn't leave anyone behind, and I'm glad that's happening here once again. So we're going to have Restore Education on in about the next 8 minutes, and we'll be right back. This is Dr. Doug, KROV FM, the heart and soul of San Antonio. That was good.
Very cool. Very good.
I say